Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today we are checking in with a startup that is based out of Kenya, working in 8 different African countries to help bring, and I love this, affordable and on demand healthcare to everybody with a mobile phone with one swipe of the finger. So, here to tell us all about Zuri Health is its co founder and chief operating officer, Titilola Olaolu-Hassan. Titi, it's great to have you here.
Thank you so much for having me, Jessica. I'm super excited to be here.
I'm excited to talk to you. You are a company, Zuri Health, which is working with Bayer, and we'll talk about the partnership that you have with them in a little bit. But before we get to that, I really want to hear a little bit about the service model that you've designed because you guys, it's really empowering people to take control of their healthcare by using their mobile phone. You have a website, you have an app, you're connecting with patients on WhatsApp, on SMS message, 100 million plus SMS message visits. I mean, really cool statistics. So why don't you get everybody acquainted with Zuri Health? Tell us what you do.
Okay, glad to share about Zuri Health is a African health tech company. Like you said, we operate in 8 African countries. Now, what our mission is to provide affordable and accessible healthcare to underserved communities in Africa. Now, when we were starting Zuri Health, we started with one thing in mind. We did not want anybody excluded from quality healthcare. So, what we decided to do was we decided to remove the barriers that stop people from accessing healthcare. How did we do this? We looked at it very simply. A huge percentage of people in Africa do not have access to healthcare. They can't afford it. And some people have to choose between eating and going to the hospital when they're sick. It's actually a quest for survival. So we said, for providing accessible healthcare, we need to provide solutions that are extremely affordable. Anyone who can afford a bottle of water can access our services. And we provide our services through 4 channels. We provide it through our website, our WhatsApp chatbot. So the same way you chat with your family and friends is the same way you can chat with qualified medical doctors. You can also get access to our app or to SMS services. Now, the SMS services are actually a game changer. To other people, texting is a very simple activity. But for people in Africa, 65% of them do not have access to smartphones.
Oh.
And these are the people who do not have access to healthcare the most. So we had to bring a solution thinking about how the customer could access technology, how patients could access technology. And so we also have SMS services, and we have an agreement with the biggest telecommunications company in Africa to launch in 21 African countries, and we're currently present in 8 countries.
So exciting, my goodness. And I love this real focus on creating an affordable and accessible way for these underserved communities to get the healthcare that they need. I mean, say a little bit more about that because I'm pretty sure that, like me, my audience really doesn't know, what's going on, state of play in these different African countries that you guys serve. So give us a sense of, I mean, you talked a little bit about, accessibility or lack thereof for a lot of people in these underserved communities in Africa to have smartphone. But tell us a little bit more about this patient population. Like, I mean, are they located in rural areas? I mean, what are some of the other barriers that might be in place? I mean, is there a health literacy challenge? I mean, I'm looking at this through a very American lens, I'm sure, but I'd love to hear a little bit about what are some of the challenges that are, typically present when engaging with these populations that are underserved. Is there fear of the health system? I mean, tell us what it's like.
Very good question, Jessica. So, like I was saying, what Zuri Health is trying to do is remove those barriers. And some of those barriers include cost. Some of the barriers include inequitable distribution of healthcare resources. Some of those barriers include a very, very poor patient to doctor ratio. So the average ratio is one doctor to 10,000 patients. And there are parts of Africa where the ratio is 1 to 45,000 patients. So you do not
Wow.
have an equitable distribution of healthcare resources. So, how do we bridge this gap? We're saying that as long as you have a mobile phone, which very funny enough, in Africa, almost everybody has an African has a mobile phone. There are countries where the mobile penetration is 107%.
Wow.
So because we have identified everyone has a mobile phone, we're saying that we can turn their homes or wherever they are into a hospital for first level medical consultation. They have a phone, and we make it as affordable as possible, so they no longer have to worry about, am I going to be able to get a doctor? They don't have to worry about queues at the hospital. They don't have to worry about the cost of transport to the hospital or how expensive the consultation is. They can just bring out their mobile phone, and regardless of the type of mobile phone it is, there is a pathway and a gateway to access our services. So we're talking about people in villages. We're talking about people in communities where you don't have hospitals. We're speaking about people in the urban areas, in the cities, who are at the lower end of the income earning bracket, people who can make time off work because if they don't work, they don't eat. And because of that, they put off going to the hospital. We're talking about even the busy executive who can't leave his house or his office to go to the hospital because it's going to take up so much of his time. Now you can get that first level medical consultation by just accessing, same way you chat with your family and friends, same way you talk to your colleagues, you can just chat and you're immediately connected to a qualified licensed medical doctor who can give you the care or the information that you need.
I love this. And I love too how you have your prices published on your website. Not only that, but you guys also have created these different types of like payment options for people. So like there are like membership packages that folks can sign up for. I mean, I saw one and it's like, for the entire year, there's like a fee and you get unlimited texting with the doctor, unlimited texting with the therapist, unlimited texting with a nutritionist, and then other discounts on like lab tests and prescription drugs and things like that. Say a little bit about how you guys arrived at this like very multi-tiered kind of pricing model so that there's a little bit of something for whatever anyone can afford.
So for us, like I said, the key thing to remember about Zuri Health is that we're trying to remove barriers. And unfortunately, we've seen over the past 2 or 3 years that there is a cost of living crisis in so many African countries. We believe that everybody should be able to access healthcare. And I think it's a very painful thing when you see people dying of things that are completely preventable. So, because of this, we wanted to provide services and give people access at a price point that they could all connect with, and also provide services that takes care of people holistically. So we're not just looking at, chatting with the doctor, but a lot of people are under tremendous pressure, there's stress. And in Africa, people don't really talk about mental health. So we wanted to provide a service that would provide you things that would help you with preventative care. So, like a nutritionist who can help you. So, people who, for example, just because of the cost of living crisis, can no longer afford to eat certain types of protein, they can connect with a nutritionist who can tell them cheaper, more affordable alternatives. They can connect with a doctor who can help them to treat the acute or chronic illnesses that they have and cost everybody can connect to. So we have various models that people can connect to. We have commission-based models. We have subscription models. To actually talk to a doctor is for less than 10 cents, and we keep that same pricing point in all the countries that we're at. So the key way that we are able to actually gain revenue from the services is from the deepening of the service. So accessing a doctor as affordable as possible. But when people begin to deepen the service, that's where we're able to make more revenue. And what we also do is we also want to widen and deepen access to insurance so people can get deeper care and not just first level consultation, but deepen the care that they have, as well as support people who have chronic illnesses with continuous care and being their companion through their illnesses. We don't want anybody to be left out because of their social economic status.
That's fantastic. I love that. All right. So tell me a little bit about what you're hearing from your patients. Like I was stunned at the amount of engagement that you have. I mean, like you said, like over 1 million SMS consultations. So tell me a little bit about what you're hearing from your patients, because I mean, to follow on your point, a lot of these folks haven't been to the doctor. It's been a while, and now they're coming in, and that's a little bit unnerving. So like, what is the feedback that you receive from your patient base? Tell us a little bit, brag a little bit for us.
I wish I could brag, because for us, we feel an urgency to get in front of as many people as possible who need care. The feedback that we get from our patients, in fact, we currently have a series called The Voices of Health on our YouTube website, which you can also check out, where we talk to people in the communities where we go to do free
Cool.
medical camps. So we do free medical camps, we onboard people for our services, and a lot of people give us the feedback that this is the first time that they're able to consult a doctor for even the simplest things, things that make a huge difference to their lives. People who have lived with chronic pain for years and have never been able to get to the bottom of the chronic pain. People who are dying from things like malaria, which we have modern treatments for. People who, in villages, who did not know that they were diabetic until we came into their communities and did a health camp, and then did our follow-on care using our digital platforms, and followed with them through for months to make sure that they were getting their blood sugar under control. I mean, the stories are endless, but we're not tired of hearing those stories. So we feel an urgency to get our services across the whole of Africa, and that's what's driving us.
All right, so let's talk about the doctors now. 600 plus doctors. Okay, how do you grow? I mean, like, this is the thing, right? I mean, you said that there's an unequal distribution of doctors to patients. So what are your plans for growth, particularly when it comes to engaging the doctors? I mean, tell us a little bit about their experience if they are a doctor that works for Zuri Health.
Okay, so again, like I said, we have 4 channels, and dependent on our channel, we have different types of doctors. So we actually have a digital locum of doctors who give us their free hours, and when they work on our channels, we pay them a monthly fee. Now, I did mention that there is an inequitable distribution of doctors, and the doctor to patient ratio is actually quite bad. But at the same time, a lot of doctors are not being paid enough where they're working. And there are a lot of doctors who there are no facilities that they can work with. So those doctors were giving them an opportunity to serve patients and get paid for serving those patients. And in doing so, we're also preventing more doctors from leaving the continent to other continents when we actually have a deep need for doctors in Africa. So we are onboarding doctors. We're always in the process of onboarding doctors. And over the past 2 years, we've been able to onboard over 600 doctors. And every day, we still receive requests from doctors who want to come on board our services. And we expect that as we go to more African countries, that we'll continue to deepen the access that people can get to not just having the first level consultation, so putting specialists and making specialists available at affordable cost for the patients who come on our platforms.
Ooh, I love that. Specialty medicine is what I think is going to be so hot with digital health coming soon. All right, let's talk about your partnership with Bayer, because what I love about your organization, TC, is that like you are very mission driven. Like I can feel it in every word that you say. And this project with Bayer is also has to me a very important mission. And so tell me a little bit about that. You've partnered up with Bayer G4A through their digital health program, and specifically it is to help get contraception, modern contraception, in the hands of 100 million women who otherwise wouldn't have access to it worldwide. So, say a little bit about what you guys are doing in Africa as far as helping this effort along.
So our partnership with Bay and G4A is something that's really super close to my heart. And the reason I say that is because, like I said, when we started, our drive was to get affordable and quality healthcare to as many Africans as possible. Now, we at Zuri Health, we have a very, what I would say, very kind of like conny vision, which is that we want what we want is we want to help people live happier, longer, and healthier lives. That's actually what we want to do, and we want to do that by providing transformative healthcare and giving people the kind of best healthcare experiences possible. Now, when we first started with that, our focus really was on primary healthcare. But my co-founder, Daisy, who's the chief product officer, actually won a female empowerment award from Bayer. And after we started to engage with Bayer, I became fully convinced that there was absolutely no way to achieve our vision of people living happier, healthier lives if we do not get women, especially women in low and middle income countries, access to modern contraceptives. Because the woman is the primary caregiver in most homes in Africa. The woman puts her family above herself. A woman in Africa might start giving birth to children at the age of 15. She's locked out of economic opportunities. She's locked out of an education. And going through that childbirth sometimes puts her life at risk, and she doesn't have the choice or have the information to make the choices of when she actually wants to have children. So after the engagement with Bay and after really understanding the importance of empowering women by giving them access to modern contraceptives, we came up with a project which I'm super proud of being part of. And this project is a game changer for women in Africa. We're starting in Kenya, and what Bayer is doing is they're supporting us to provide our digital platform completely free. So when we started, our vision was to anyone who could afford water could afford our services. But now we've even removed the barrier of the cost of water for women. Any woman who has a mobile phone can gain access to our digital platform where they would receive guidance, counseling, answer, get their questions answered. And if they make the decision to move forward with getting fitted with the modern contraceptives, we would refer them to our partners who would get them fitted, and we will follow up to make sure that they're comfortable with the decision that they have made. And all this is what we're doing with Bayer, and it's a
Oh, I love
super
it.
exciting thing for women in Africa.
That's amazing. I mean, this is such a, no, I mean, especially for women in Africa, but for women all over the world. I mean, this is such an important human rights issue, and wow, very commendable. That's an exciting, exciting project. I'm proud of you for being proud of what you're doing. That's incredible. All right, let's wrap this conversation up talking a little bit about Zuri Health, the business. Okay, so we talked all about your services and what you're doing and your mission. This great partnership with Bayer, but I want to know where you guys are at. You guys are a startup, and not only that, but it's like you're raising a seed round. So I found that you guys have raised a pre-seed, 1.3 million US dollars pre-seed, but that you're currently raising your seed round. So tell me, pick up the story there and tell me what's going on from a business standpoint. How are you planning to scale and grow? Tell us about this round. Get us up to speed.
Okay, so yes, we are raising our seed round. We're currently raising $4 million. We're looking at ending the round by December, so we're very open to talking with investors who are interested in making an impact in healthcare in Africa. We have a group framework agreement with the biggest telecommunication company in Africa, which gives us access to 200 million Africans. 200 million Africans who need quality healthcare and who need to have the convenience of being able to talk to a doctor or having the information that would help them have healthier lives and better outcomes with their health. Uh, we are looking for investors who are interested in impact. I think it's important for me to say that right now it is in everyone's interest globally to invest in healthcare in Africa. But not only investing in healthcare in Africa, invest in Zuri Health because that's the surest and quickest path to quality, affordable healthcare in Africa.
I love that. I love how you started that answer by we're quietly raising 4 million. It's quite so quiet. Calling you out on that. It's definitely not going to be quiet once this interview goes up. Well, thank you so much, Titilola, for being here and for telling us all about Zuri Health and the great work that you're doing. Best of luck as you guys aim to close that round. I'm sure you will have no trouble doing so. I mean, it sounds like what you've built here is really making an impact in the communities that you're serving in Africa in the 8 different countries. And I'm so impressed by that. And also by your project with Bayer in terms of helping women get the contraception that they need. So thank you again for joining us here. I appreciate it.
Thank you so much, Jessica. Thank you for telling our story. And thank you for telling the story of many Africans who are looking for a way to protect their health and protect their families by giving them
Love
access to
it.
doctors.
Happy to help in a very small way. For more interviews with the people who are changing the way that we do healthcare, like the folks over there at Zuri Health, you can head on over to my YouTube channel. It's youtube.com/WTF Health. I'm Jessica DeMassa. Thank you again for joining us. You got to check out Zuri Health. Get in on that raise before it closes. I'll talk to you guys real soon. Bye.